Thank you, Lorenzo, and thank you for the invitation. I will totally change the approach compared to the previous talks, because I will try, as an engineer, to give you the perspective, an inside perspective. I've been a researcher till 2018, and then I shifted to a research hospital. Let me at first give you a brief outline of my talk. I will start with describing which are, to me, the disruptive factors that we as a research institute we have to face in this phase. And these are disruptive in a way that we have to change completely the way we manage data and the way we manage data platforms and the way we use analytics approaches to support decision makers, clinical and organizational decision makers. After this brief introduction, I will talk you about the needs and areas of intervention that we identified as a research institute in order to face these disruptive factors. Needs and areas of intervention, and a focus, I will make a focus on data platforms for integrated analytics processes that are partially based also on the experiences we had with Lorenzo and the University of Bologna group in facing COVID pandemics. And if I will have time, I don't know if I will, but I have some case studies of application, one of which is the COVID-19 case study. So, disruptive factors. The first one is that we have, thanks to Next Generation EU, the Italian application of the Next Generation EU, that is the PNRR and PNC, huge financing for renewing our hospital information system and the components of the hospital information system. So we are not in a situation in which we have to manage data and manage data platforms in a stable condition. So we are totally shifting the technology that is at the basis of our data pipeline. And this renewal of our components bring us to the second element, that is interoperability standards evolution. I don't know how much we are aware of interoperability standards. In a way, it's the grammar we use between application software to bring all the components of the hospital information system together. In Italy, we are not that good in that, because most of the components of hospital information system are based on HL7 version 2. That is quite old. We have also version 3 in the middle, but it was not that effective in application. But all this renewal is bringing us from version 2 to FHIR. And FHIR is, in a way, a different way of interoperability, the way in which components can talk to each other, but it is also a different way to store data, and an important element in the way in which data structures should be managed in order to store data and apply analytical processes and analytics to those data. The third element is that, at least in Italy, most of hospital organization does not have a stable implementation of electronic medical records. Inpatient and outpatient medical records is thanks to partially thanks to this financing that little by little we are going to a digital version of the medical record, and so in a way we will have, and we are partially having access to clinical data and pharmacological data that before were just written on paper. So in this way, this is a third element of disruptive element for our systems. The fourth component, and in the first talk it has been presented widely, is omics. Omics that in this case was isolated from clinical data because we had not that much structured clinical data thanks to EMRs, and in this way these two components in a way give us the possibility to evaluate how to structurally link clinical information and omics information through proper data platforms. The last element is technical and computational resources that we have in order to build data platforms, but also to feed and to compute algorithms from advanced analytics. So based on these elements, and this I'm using just, I think you are quite aware of this, right? This is hospital information system architecture. And in a way, this helps me to tell that we are changing most of these components, and changing most of these components means the grammar of these components is changing from HL7 V2 to FHIR, and this brings us the possibility to empower interoperability framework, but also empower the way in which we store this kind of data. As a research institute, we are not an island, but we should be aware of what is the ecosystem in which we live. And in this case, it is very important from a technology perspective to be aware of initiatives that are present at a metropolitan level or at a national level that are bringing research institutes like Sant'Orson, but like all the other research institutes in Italy, to build data platforms to feed clinically research-oriented approaches, data-driven clinical research-oriented approaches. The first one is unveils-D, and it's a framework, a data platform framework between the three institutes of the Bologna area, that is Hospital Sant'Orsola, Istituto Ortopedico Rizzoli, and the Neuroscience Institute of Bellaria. And this, in a way, is telling us data platforms for research are so important that we can not only think at a corporate level, but we also have to think these kind of platforms to be able to dialogue with metropolitan platforms and, in future, national platforms. And since we do not have a proper data platform at a corporate level, we should evaluate its implementation, being aware of these two additional levels. Okay, given the disruptive factors, given the ecosystem, this is the experience we are having as Institute of Sant'Orsola. So we decided to build up a research platform that is not a clinical research platform, but a research platform that is focused on implementing data structures and algorithms for the management or the integrated management of assistance and research data. What are the basic needs that we identified, technological basic needs we identified, that can be summarized in three main levels. At first, the redesign of the corporate information system in terms of strengthening technical infrastructure and tools for data collection and processing. Mainly in Italian institutes, research or health institutes in general, we can find common data warehousing approaches. Common data warehousing approaches that are pretty good, effective and efficient for administrative data processing, but are totally unfit to support advanced analytic approaches or data-driven approaches. So the first technological effort we had to make is to change completely the technical basis of the data platforms. And the two following elements are the support of research activities through systematization of clinical data collection and the quantitative support to improve care processes. So, in a way, we intended a complete data-driven research platform as a data platform that has to take into consideration not only the importance of data for clinical research, but also the importance of data for organizational research, not qualitative organizational research, but data-driven organizational research. And this means simulation, discrete event simulation-driven organizational research or combinatorial optimization, data-driven organizational research. And in a way, this brings us to say that data platforms for research cannot be separated from data platforms used also for organizational and administrative activities. As a consequence, the areas of intervention that for a willing data-driven research institute, as we would like to be, are, for us, these three main areas. That is methodology and operations, business intelligence, that should be renewed based on the elements I told you before, and data science and decision science. That is, in a way, as I told you, clinical and organizational driven, data science and decision science. Okay, so what is then the first element? And a fundamental element for a technologist like I am, and I think most of you are, is the data generation and storage pipeline. Because as I told you before, current data warehousing approaches are unfit to support advanced analytical approaches. So I tried to sketch for you which is the data pipeline that we are trying to implement. And we are trying to implement also thanks to their initiative, that is one of the partners of this school. So at the first level, we have a data production area. Data production area is composed by clinical and administrative, for us, data production application software. That is the admission, discharge, and admission and discharge application software, emergency department, operating room, laboratory information system, and so on and so forth. Okay, so these are all the data production area, the basic ones, okay, the ones that you can find everywhere. Then we have a second level, a level that we are about to implement, that is the electronic medical record area. That is composed by inpatient EMR, outpatient EMR, and last but not least, very important for research institute, hub and spoke EMR. Because outpatient and inpatient EMR are closed EMR within your organization. But for research institutes that are in a way hub for specific areas, not for all the areas, but for specific area, hub and spoke EMR are a key component because clinical pathways for patient can start in spoke and then upscale to the hub area. And so the electronic medical record, clinical data, pharmacological data in a patient, in a clinical pathway, from a clinical pathway point of view, should be also developed using, thinking about a hub and spoke EMR. In most of cases, we may think that an EMR is a collector for the data that are generated in here and the data that are coming from here, okay? So this can be our data platform. That is partially true. It is partially true because we may have different sources of data, structured and unstructured, also related to at-home activities that cannot be stored all in here, but should be stored in a common data platform for research institutes. That gets the data from the EMR level and from the data production area level. And this data platform, I try to summarize in here the two elements that should stay from, let's say, our point of view together. The data lake structure that is perfect for research, perfect for integrating the different sources of data, and the data warehouse level that is fundamental for common management and administrative activities. It is very important to us that warehousing and lake are not two parallel experiences for a research institute, where both of them are directly linked to the data production area. Our effort is to build this upon this, okay? To go from a pure data warehousing approach to what is called nowadays a data lakehousing approach, in which in this level we have a unified level of the unique data level for our organization. This is very important to us because if we think about scaling up our data processing for research purposes to Mobilise-D or to the National IRCS platform, if we do not have this one, and our institute does not have this, and I would say I'm quite sure about this, a lot of research institute does not have a structure like this. What will happen is that from this level, we go up to that level that is not so efficient from a global point of view. Okay, but this is just the data generation and storage pipeline. We are missing one additional level. And for us, an additional level is what we do with this data, okay? Because storing data is cool, storing different kind of data is cooler, but then, okay, we have data. But what do we do with this data? And the idea in the research platform I presented you before is to build up this analytics platform that, as I said, you should take these two elements, AT is missing in here, these two elements that are common for data warehousing, okay, it's old style stuff, but should stay in the same platform, and adds some more complex analytical activities, okay, that is not only AI and ML for clinical research purposes, but it's also organizational-oriented techniques like hybrid simulation tools and combinatorial optimization. Well, I'm quite focused on this because I'm coming from this from the research perspective, since I'm an operations researcher. So this is very cool. It's very, very important, but from an organizational perspective, this is also important. And we should implement also this. What we need skills. And because we do not have this kind of skills, or we partially have this kind of skills within our organization. And for this, initiatives like there are very important because may help research institute to think about or identify these kind of skills. But we also build up a joint laboratory with the University of Bologna to bring with us some young data scientists to work on this kind of elements. With what? With what you know as platforms and languages for building up this kind of tools. What is the impact on research activities we think this kind of architecture may lead us? Structured storage of clinical data, inpatient and outpatient, as I told you. Development of clinical software oriented to clinical research, because a key factor is that outpatient and inpatient EMR, from a technology perspective, may be implemented by software houses on a basic level of data, common level of data that it is needed everywhere, in a research institute or in a local health authority, big or small that it is. But as a research institute, we need some EMR, inpatient and outpatient, that are flexible enough to store also research-oriented clinical data that are not standard data, but are important for our research. And then organizational research. And I will stop with this because otherwise I focus too much on that. The DARE initiative. The DARE initiative is part of this process because we are part of a pilot project that is, in a way, an improvement of what we did with the group that was led by Professor Chiari at the University of Bologna in terms of taking data from different sources, and we were aware also with this experience that our current structure was unfit for this, and then implement some predictive approaches that will help us not only from the clinical point of view, but also from the organizational side. I think I end up my time, and as I told you, I think I have not time for case studies, but in cases, if you have some question about that, I will be happy to. 2 minutes. Okay, 2 minutes. So this is what Lorenzo told you before. What we did is that to bring together research institutes, health organizations, and to develop some predictive approaches that helped us as an organization to predict what will be the impact of COVID pandemics in terms of number of beds and different kind of beds, acute beds, or I don't remember the name of intensive care beds. And to use this kind of approaches, not only from a scientific point of view, but from an operational point of view, because every week we discussed this kind of prediction with all the general managers of the health organization that were managing together the pandemics. And as I told you before, the importance of developing a common data sharing infrastructure was a key element that we were not ready for at this time. And so this is a central element of the infrastructure we want to build. I do not have time for the other case study, but I think it's enough for you today.